Hi everyone, welcome to researchmd.com. Another great presentation, another great topic today. Memory improvement. Should we do Kirtan Kriya yoga to improve memory? When you talk about memory, like everyone is scared, right? Am I going to lose memory? Especially, let's say if you have elderly parents, you just kind of, when they get older, you always kind of, you hear about Alzheimer's dementia. They cannot remember where they are. They cannot remember a very important, scary thing in the society, right? There are no medication to treat. So what should we do to improve our memory is the topic today. Again, all our presentations are based on pure science, okay? Is there a scientific study behind it? We will publish it. Again, my name is Pramil Cheriyath. I'm a program director, internal medicine residency, transitional residency, and I teach medical students and residents on a regular basis. I'm also a director of research, and I'm in a assistant professor of medicine, internal medicine, and transitional residency also. So when you talk about what is Kirtan Kriya, right? Yoga have like so many different varieties, so many different, it's an ancient practice kind of originated in India a long time ago. There's something called the syllables they use like sa, ta, na, ma, okay? So they use these words to repeat yourself louder, and sometimes you whisper, there's a special technique, you hold your fingers and it's like sa, ta, na, ma. You repeat that loud, and then you whisper the same sound like sa, and then you repeat that in your brain without making any sound, okay? So that's what Kirtan Kriya is and all that. So next thing we have to do is, like, we did some literature studies, and we found Journal of Alzheimer's disease, where dementia is like very common, and we found this great study, and we're going to talk about it today. So objective of the study is, like, does Kirtan Kriya meditation or like music listening on cognitive outcomes, okay? Does it improve the memory? That's the main thing they were looking at. Again, it's a randomized control study. When you talk about randomized control study, the evidence is really high. You have to practice they were asked to practice like 12 minutes per day for 3 months, and they had the discussion, they can one day, they want to do more than 3 months, but mainly for 3 months. At baseline, they measured the data. 3 months they measured, and then 6 months they measured the memory, cognitive functioning, all of this using the different scale they used it, okay? And participants of Kirtan Kriya, they also listening, the music listening showed like significant improvement in the baseline, the memory and cognitive functioning, okay? You look at the p-values, the statistically significant results improving memory and cognitive functioning in both groups, Kirtan Kriya and music listening. So you got the results are given right here. Seems like Kirtan Kriya is performed much better than the music therapy. In conclusion, based this randomized control study, we can clearly say that meditation using Kirtan Kriya have a significantly improve the memory function and the cognitive performance of the adult. So if you have patients suffering dementia, or you're worried about your memory, please do this on a regular basis. And all of this kind of take take time. You cannot just doing like one day and all that. It's consistently like 2 to 3 months you're doing, you will see an improvement. If you see you have patients like elderly patients suffering from this dementia problem, please teach them about some of this technique and see if any improvement, okay? Thank you so much for watching. We'll be back with another presentation soon. Thank you.